I use Stimpod every day, and I'm currently have three in the office. The more Stimpod you use and the more people you treat, the more difficult cases you're going to end up treating. I had two stroke patients referred to me. Whenever you treat a stroke patient, it's a very long treatment. I honestly don't really want to do the treatment. I'd prefer if they would rent it from me. What our office charges is $500 a week for a rental. And the way that I approached a stroke patient, the first one had a stroke while she was in Italy, and it was her full right side of her body was, she was about at 50% usage. And her problems were everything from upper to lower extremities. She had urinary incontinence. We treated her. We got her walking without walking assistance in the office. She walked about maybe 50 feet without anything. We're going to increase the tone of the nerves and then activate the muscles to make everything function more normally. So that's the incredible thing that Stimpod can do for stroke patients. And then the second stroke patient is a medical doctor that was on safari in South Africa, and he had a stroke when he got to Cape Town. Got medevaced here to the United States. He has recovered, other than he's got neuropathic pain in his face. He's coming in this week, and I'm going to encourage him 100% to rent the Stimpod at $500 for the week just so he can treat all of those nerves in his face. So those longer, more complicated sessions, I would prefer them to do it. What I actually do is I'll take pictures of me doing it to them. I'll take a permanent magic marker and mark the nerves on their body so they can just go home and do it themselves. I treat people virtually consistently. I'm treating a little girl in Seattle who either 4 or 5 years ago, and she's 9 now, she had compound fractures of her radius, ulnar, and her humerus. And they wanted to amputate her arm, and they got the vascular flow going, but the nerves were not working. Her arm is completely atrophied. And this is 4 or 5 years later. We're treating her, and it's pretty amazing. She can move her hand now when she previously couldn't. And mom is completely beyond ecstatic. They sent me the preliminary video that you possibly might see. The main focus and people use for Stimpod is treating neuropathy. When I treat neuropathy, it's going to take a minimum of 20 minutes. I'll set the patients up and I'll explain how I want them to treat themselves, and then I just walk away. And if I had just one Stimpod, that would stop the flow of the practice. And like I said, right now I only have three, and it kind of makes me uncomfortable having only three. It would be totally reasonable for me to have all three Stimpods going concurrently in the office. So those are just a couple examples why you need more than one Stimpod. I don't know why anyone would buy less than three. Once you use it, you're definitely going to need to buy more because you're going to get results, and like the people are going to come. The home usage is actually the easiest way to do it. It's a lot easier for them to do it at their house. They don't have to make the effort to come into your office, and they can treat themselves actually cheaper than as if you would treat them. Basically, you need multiple Stimpods for one reason. If you have only one Stimpod, you're limiting your ability to treat patients. With Stimpod, you could treat anything, honestly. You can literally treat anything and everything, whether it's musculoskeletal, going from plantar fasciitis and neuromas in the feet, to knee pain, to urinary incontinence, to nerve pain, to trigeminal neuralgia, Bell's palsy. So your spectrum has expanded by 1,000%. And if you're a chiropractor and you're just treating skeletally, then your practice is this big. When you add Stimpod, you can treat the musculoskeletal conditions that you have, like a herniated disc or whatever, but now you can treat all these neurological conditions that there's literally no treatment for. I get referrals from 3 different neurologists, and the only reason I do that is because I do use Stimpod, and I will show them. And then when they see that, they're like, oh my gosh, this is a real viable alternative. Summing it all up, do yourself a favor and get multiple Stimpods. If you have one, you are limiting yourself and the ability to treat and get things done in your office.